Preclinical Skills 2. Desensitizing agents. You will need You have 15 minutes to complete this skill.
Today we're going to be applying a desensitizing agent to tooth number 4-3. The patient has a sensitive area, an exposed root, and so we're going to apply one of 3 types of desensitizing products. The first product that I'm going to demonstrate is the application of a varnish. And the product that we're going to be demonstrating the use of today is a Durafluor fluoride varnish. The first thing that you can begin by doing is dispensing a little bit of the product into a Dappen dish such as this. This is a disposable Dappen dish. So you'll see on this side I have the fluoride varnish. It looks like a sticky yellow type of consistency. And then on the opposite side, this is what we're going to actually be applying to the patient's teeth. So when you're practicing on a student, you can apply just the PreC toothpaste rather than reapplying varnish repeatedly. Now we're going to begin by isolating and drying the tooth. So you're going to place the cotton pellet, cotton roll, next to the tooth that you're working on. A Q-tip or cotton swab can be used to clean and dry the area rather than using the air water syringe to dry the tooth, because with patient sensitivity that's going to make the tooth more sensitive. A microbrush such as this can be used to apply the Durafluor varnish. So again, just take some of the toothpaste rather than the actual varnish and apply that to the patient's cervical area where the recession would be. And then you can remove the cotton roll right away, because with the fluoride varnish, it hardens on contact with the saliva. So no rinse would be required at this point, because that's going to actually wash the varnish away. And to check to see that the varnish has been effective, you can blow a quick puff of air over the area to make sure that the patient isn't experiencing any more sensitivity in that area. For post-op instructions, you would tell the patient that they're going to expect that they'll see yellow sticky film over the tooth surface, that again it will harden on contact with their saliva. They're not to brush their teeth for the next 4 to 6 hours and allow the desensitizing agent to remain in that area. And they should eat some soft foods, a soft food diet, again, so that it won't wash away or remove the varnish right away. They could have something to eat though within the next 30 minutes, but they should be advised to chew on the opposite side. Next desensitizing agent that I'm going to demonstrate is a liquid type of application, and the product that we're working with today is the PreC liquid drops. So using your small disposable well again, you're going to dispense 2 to 3 drops of the liquid into a well, just like this. And then on the other side you can see that I have some of the PreC toothpaste dispensed, because that's what we're going to actually apply to our practice patient. You're going to isolate the area using a cotton pellet, cotton roll. dry and clean the area with a Q-tip. And using a micro brush such as this, apply some of the toothpaste, which acts again as the liquid desensitizing agent. For the liquid, you usually have to rub the cervical area repeatedly a few times. And then you're going to disperse the material by blowing a few quick puffs of air. With a liquid type of desensitizing agent, reapplication is usually required, maybe 2 or 3 times. So again, you're going to apply in that same area just by rubbing for 10 to 60 seconds. And after 2 or 3 applications, they shouldn't feel any more sensitivity. So to test your application, you can blow some air and the patient may report that they're no longer experiencing any sensitivity. To remove your cotton roll, it's helpful just to use a little bit of water from your tri-syringe on the cotton roll so that it doesn't get stuck on the inside of their lip. But it is important after the application of the desensitizing agent not to give the patient a full mouth rinse with this type of desensitizing agent. So also let the patient know that the desensitizing agents in general last up to about 6 months. And when you're using your desensitizing agents or any product, remember to recap the product immediately after dispensing it. The third desensitizing agent that we're going to be demonstrating today is the light cured type of product. And usually this is done for a patient who's having sensitivity in a tooth that's being restored. So this may be done in combination with bonding prior to a restoration being placed. So in this instance, the patient has already been isolated with a dental dam in order to do the restoration, and the patient may require anesthetic before the procedure is started. So in this way, where the dental dam is covering the dentition, we're going to avoid contact with the mucous membranes because with this desensitizing product, it can lead to sensitivity in the oral mucosa. And if it were to contact the tissue, it should be rinsed immediately, flushed with water, rinsed and reapplied after isolating the tooth again. So what we're going to do first is we're going to isolate and dry, as we've just said. So we've placed the dental dam, and we can avoid desiccating the dentinal tubules, or the dentin, and leave the tooth moist for the application. The other thing that's involved with this light cured type of desensitizing agent is the use of an etchant. So we would apply the etchant again to the area of the 4-3, and we would leave the etchant applied to dentin for up to 15 seconds. We're then going to use our high volume evacuator to remove the excess etchant from the tooth surface, and then we're going to rinse and dry the area, leaving the dentin moist. Your desensitizing product can then be dispensed into a mixing well or directly onto the applicator. The product that we're going to demonstrate today is the Gluma desensitizer, and this comes as a single dose applicator. A single dose applicator means that it's disposable. So it comes in a tube like this. The applicator microbrush is actually part of it, and the material is found in the bottom of this cap. So the material is in the bottom of the cap, so you remove the top, dip your applicator brush, and then apply it to the tooth. So we're going to leave it on the tooth undisturbed for 30 seconds. this material is not going to be dispensed until it's ready to be used because it will evaporate quickly. We can remove the excess by blowing some air and then we're going to light cure according to the manufacturer's instructions for up to 20 seconds. A second layer and light curing may then be applied. Once the material is hardened, the post-op instructions would be given to the patient, the restoration would be placed, and the post-op instructions for anesthetic would be provided. Keep in mind that, again, the desensitizing agent should last up to 6 months.